Okay, everybody, I think we'll start. I'm Annie Laverty. I'm Director of Patient and Staff Experience with the Trust. So wanted to extend a really, really warm welcome to this evening's event. I'm very much looking forward to all of the discussion that is going to fall out of it. So I'd wanted to start really with a welcome and huge thanks to our speakers this evening, to Alice Wiseman, who is Director of Public Health for Gateshead and Newcastle, and then our very own Dr. Balsam Ahmad, Consultant in Public Health at Newcastle Hospitals and also Honorary Lecturer at the Population Health Science Institute. As Director of Patient and Staff Experience, the arts in hospitals have always been really, really close to my heart. I've been able to understand, I learned many, many years ago about the difference that art in hospitals could make for people with dementia, to create environments where people felt safe, people felt calm. The way that art can signpost people around a hospital and find a way through to them when they're navigating so much complexity in their own lives. I learned about music in hospitals and how it could engage people with brain injury and give them a mechanism and a way of communicating that when that had been taken from them as a result of their stroke. So we know that access to the arts and participation in art in hospital environments, we know it can dramatically improve health outcomes and well-being. I'm sure we're going to hear tonight about how it can counter inequalities that exist and encourage social engagement. And as a supplement, really, to medicine and care, the evidence suggests that engagement with the arts can improve a person's physical and mental well-being. We know that the benefits of arts activities are seen way beyond the traditional settings and boundaries of our hospital twos. So it plays a role in supporting our communities and individuals who may otherwise be excluded. And the benefits of that are increasingly being recognised. So I'm excited about this evening. I'm excited about what I'm going to learn. We know that there's a need to scale up the importance of this work and to increase public awareness and understanding of the role of arts in health. We need to encourage best practice in our own hospitals. We need to have shared ethics, research and evaluation, really, while celebrating and supporting definitely the passion and drive of so many practitioners who support arts and healthcare activities and make the difference every day for our patients and our staff. At Newcastle Hospitals, we are incredibly lucky that the charity supports a Hospital in the Arts programme, a thriving programme under Katie Newell's leadership. So Katie, if I can just hand over to you.
Thank you. Thanks, Annie, for the introduction and for your support, as always. Welcome, my name is Katie Newell. I am Arts Programme Manager at Newcastle Hospitals Charity. This is the second event in a series of work highlighting the work that the charity supports. And I'm delighted to find so many familiar faces here. I'd just like to welcome you all and thank you all for revisiting us when we had to postpone at short notice. It's very appreciated to see you all here. I'm delighted to be welcoming Alice and Balsam here tonight and look forward to our discussions later. I'm going to present first and I'd also like to welcome Caroline and thank you for being with us as BSL interpreter tonight. Unfortunately, Vikas Kumar couldn't be with us this evening. He's Director of GEM Arts, and I'm sorry to miss him this evening, but I'd like to also acknowledge the significant role of GEM Arts in our region and the support that they have in developing healthier communities and diverse audiences, but particularly in supporting the practice of South Asian creatives. If you don't know who GEM Arts are, please do look them up. They have amazing programming. I'd also like to thank the musicians, Dave and John, who you may have heard kindly playing as we've been meeting each other outside this space. They're two of a number of musicians that we'll be working with regularly to provide more live music across Newcastle hospitals to enhance and improve the patient experience whilst also supporting staff well-being. Tonight we're putting the spotlight on arts and health programmes with the title Beyond Paintings on Walls. So I have a caveat to that. I love a painting and in fact spent 4 years gaining a degree in such an art form many moons ago. So I do truly believe in the value of paintings and acknowledge the significance of how painting has fueled my interest in the arts, but also supported my well-being throughout my life. I love staring at a good painting. I'd also like to further acknowledge that the considered and considerate design of the healthcare and hospital environment has proven to support the well-being and aid the recovery of patients, saving the NHS money. So we know that integrated art schemes and what is displayed on our walls do in fact matter. However, what we're seeking to bring to the fore in these discussions this evening is perhaps the often underrepresented aspects of arts and health programmes in the wider public canon and their evidence benefits. I'd also like to acknowledge that arts and health can be an emotive subject, and even though someone may be speaking within their professional capacity, either as a speaker or an audience member, it's likely that our personal experience of the NHS or care setting is present in our minds for us all in the room and for those who may be listening to the recording of the event. Therefore, I'd like to encourage anyone to come and go as they please and to prioritise your comfort and well-being in this space this evening. So, the format of the evening is that each of us on stage will take a turn to speak and then go into a discussion, which we hope you will be part of. So to the arts in health, arts and health, arts in hospitals, creative health, arts in healthcare, why are we all gathered in this room? I'm hoping it's because we either believe in the significance of arts within a health and caring context and interested in how we sustain and nurture it, or we're intrigued to find out more about what it is, why it exists and what it does. And why are we hosting this event when we are so relatively early in the journey? We're just 3 years into our programme. And it's because we're taking the opportunity to value the arts and health programme and to make sure the benefits are communicated, known and understood. I'd quote Rebecca Solnit, "Within most examples of broad consensus lie a host of questions and unresolved differences. Agreement is only the foundation. Yet from here, we can build strong communities of love, spirited movements of resistance." This is to be in a room together, to galvanise and enthuse, find commonalities and bring people together to create energy, to keep moving forward with the work. And a bit of an explanation about what I'm talking about with regards to the arts. I'm including writing, reading, music, singing, painting, photography, film, truly multi-art form. And for me, the health is the context or the why we've encountered the arts. So perhaps it's because we have a condition or care for someone in which we are regularly and or for long period find ourselves within a healthcare setting and the arts becomes of therapeutic benefit. Or perhaps there's a proven clinical benefit to a specific health condition one has, such as singing for lung health, to improve lung capacity, or dance programs designed for improving balance, muscle strengthening and fall prevention. And also with health in this context, I'm talking about being able to self-advocate in our chosen mode of communication. Drawing, dancing, singing, humming. I'm talking about the experience of being human from birth to death and everything in between. I'd put to you all that the arts has the capacity to make us kinder, make us more understanding as humans, and is a way of communicating that opens up so much more access to understanding oneself, the complexity of our own life experiences, and the experiences of those around us. Some of you have heard me speak of my personal experiences with the healthcare system and how the arts has supported me and those around me, so I know the arts is of benefit. I've seen it firsthand on countless occasions. However, this evening you don't just have to take my word for it. I wanted to share a quote from a staff member when asked to feedback on the experience of having live music within their ward. So this is from one ward. So many examples, I don't have space to document them all. Our pregnancy loss patients stated they felt comforted and as though they had a companion with them when they listened to the music. They stated they felt at one with those around them and they were not as alone. Our elderly patients who have delirium had a noticeable improvement in their mood, felt involved and not as isolated, and their visitors commented on how it was as though they were like everyone else through their joint love of music. Our young patients with schizophrenia and personality disorders were visibly calmed by the music, and the social aspect had great impact on them, being included with other patients on the ward and all coming together. Our palliative patients were calmed, very upset and emotional, but commented this was due to the beauty of the music and the beauty of life it brought to them. They said they would not have wanted to miss it, even though it brought out this emotion. We also had a patient who was blind. She said it connected her to her surroundings more than anything else and gave her a sense of the togetherness and camaraderie which she could not sense without the sound, as she uses music in her personal life to connect her to the world. She states how she sees flowers, meals, and people through different types of music to represent them, and this made her feel comfortable, safe, and at home. Through these busy times, staff were able to use these music episodes to connect with the patients and to enjoy it themselves also. It brought a sense of calm to the ward, even though the same working activity was still going on. I cannot stress enough how valued, appreciated, and wonderful all the musicians were. It was a valued talking point for patients to their relatives and friends at visiting times when otherwise all they had to focus on was illness and hospital routines. Patients became a great comfort to each other as it allowed them to start a conversation and allowed friendships to build with a common interest that everyone could appreciate. When I first started in this role, I saw an email exchange, not from within the trust, I hasten to add, but it was a genuine ask for who may know how to measure the benefit and value of arts and culture. Instantly, I thought of all arts and cultural organisations and individual creatives and collectives who have to do this on a daily basis in order to sustain their existence and practice. And I think that's when I had the naive realisation of having come from somewhere that continually fought for itself, the arts sector, to the health sector that didn't realise perhaps just how much the arts sector had been building up evidence in terms of how it supports people to live healthier lives for decades. I am, of course, mindful that we live in a value-based system that does not always prioritise the arts as a whole. As the arts has been cut more and more from our education systems, the experience of the arts from a young age is often dependent on whether there is interest or passion in the arts from those around you. It's about access. So it's one of the hopes I have for our programme, that those most marginalised in our communities gain new opportunities for access to the arts, as they are often those who find themselves most in connection with our health and care services, but with the least amounts of seats at the table. My hope is that when these individuals and those that care for them are challenged in ways that feel insurmountable, never-ending through ill health, that with and through arts participation, they can find ways to process emotion and find opportunity to express themselves, building confidence and being able to articulate their needs and their interests on their terms. And also similar hopes for health and care staff, like a member of staff who said on beginning to write poetry after our first staff writer in residence programme, if I can get it out of my head, I don't have to hold on to it in the same way. It, being referred to, is stress, anxiety, grief and trauma. And my last hope is that the value of arts and health is further understood by our health and care systems, and one which I feel is growing nationally. I can see a shift nationally in the understanding through our National Art and Hospitals Network that we're part of and the National Centre for Creative Health. How that translates and at what pace is an unknown at this stage, but I am heartened by the number of people in this room and look forward to what discussions that may bring. The format of the evening, as I've said, is that each of us will have turns to speak. I've had mine, and then we'll open up to discussion. So please do keep in mind questions as you have them as they come along. So Alice, I'd like to invite you to speak. Thank you.
Yeah, so thank you very much. It's really lovely to be here and great to see so many people. Sorry about the cancellation. I think that was partly my fault last time, but we were dealing with a major incident across the city. So apologies, and it's great to see so many people who've made it for tonight, especially given how cold it is outside. So as explained, I'm Director of Public Health in Gateshead and in Newcastle. I've been in Gateshead since 2013, but just started in the city earlier in the year. But I have to say it's a real privilege to be here in Newcastle. It's the city I grew up in. You know, it's a place that I've called home for all of my life, and it's a real privilege to be here and working to serve the residents of the city. So the first slide is almost a rhetorical question, I guess, because I think that those of you who do know me will know that the answer to this question from my perspective is it's a necessity. You know, and I'm not saying that flippantly. I was lucky enough to be involved with a couple of bits of work. I'm looking at Alice in the audience there a few years ago as well with an all-party parliamentary group, which was looking at the evidence base around creative arts for health, reported that out, and then a few years later involved again with another all-party parliamentary group, which reported out even more evidence there. So if anybody needs to see the evidence base that sits behind this as a programme, there's some great information available online, and I would just encourage you to look at it. For those of you who do know me as well, will know that I'm a big fan of Sir Michael Marmot. So I'm kind of assuming most people in the room will know who he is, but he's like an international expert on inequalities, and you know he's a real expert, but a real kind of advocate in relation to what we need to do to tackle the unfair inequalities that we see across our society. Newcastle City Council has committed to becoming a Marmot city. So learning from other places in the country, such as Coventry, that have done this, really thinking about actually how do we make sure that we don't just think about health and health care, but we think about the conditions that enable us to live healthy and well. So I'm going to start by reading a very short extract from his book, The Health Gap. And it just kind of sets it in context, I think. So the woman looked a picture of misery, her gait almost apologetic. She approached the doctor and sat down, huddling into the chair. The dreariness of the outpatients clinic, unloved and uncared for, could not have helped. It certainly did nothing for my mood. When was the last time you were completely well? Asked the psychiatrist. Oh, doctor, said the patient, my husband's drinking again and beating me. My son's back in prison. My teenage daughter's pregnant and I cry most days. I have no energy, difficulty sleeping, and I feel that life is not worth living. The psychiatrist told the woman to stop taking the blue pills and try these red pills. He wrote out an appointment for a month's time, and still a picture of misery, she was gone. He explained that there was little else that he could do, but the idea that she was suffering from red pill deficiency was not compelling. So I'm pretty sure that you'll agree, 2 babies born today in our fabulous local hospitals can have as much of a 12-year difference rather in life expectancy, due entirely to the circumstances into which they're born. And what's possibly worse, babies from the most deprived parts of our community can expect to live in ill health for around 21 and 17 years for women and men, respectively. And if you look beyond Newcastle, the inequalities are even more apparent, with as much as a 25-year difference in life expectancy when comparing the most deprived parts of our wonderful city to the most affluent parts of Britain. For both men and women, life expectancy in Newcastle is lower now than before the COVID-19 pandemic. And for me, the fact that poor health is significantly more common in our communities that experience other hardships, such as poverty, is completely indefensible. So despite much amazing work over many decades to improve health, inequalities in entirely preventable disease remain stubbornly persistent. In fact, as I've shown you in recent years, the difference for both life expectancy and healthy life expectancy between the most deprived and the most affluent parts of the community have been growing. Would it surprise you if I told you that health care only accounts for around 15% of a population's health? There is increasing evidence that our current system is severely limited by its disproportionate focus on treating ill health when it occurs, rather than investing in the conditions and qualities that support health over a lifetime. We have the highest performing NHS in the country, but we still have some of the poorest health outcomes. So another quote, which I love from Sir Michael Marmot, is, "Why treat people and send them back to the conditions that made them sick?" And when you consider health from this perspective, a healthy person is characterised not as only as somebody who is free from disease, but somebody who has the opportunity for meaningful work, secure housing, stable relationships, high self-esteem and healthy habits. This includes all of our individual characteristics, family circumstances, personal and family wealth and social opportunities. In Newcastle, as I've already said, we started work to work on the Marmot policy objectives that were set out originally in 2010 and then reaffirmed in 2020. And there's 6 key priorities set on the slide there. There are 2 further priorities that have been added as a result of learning during the pandemic, and something that is very relevant to us as a city, to ensure that we tackle the issues around ethnic inequalities and also climate change, or rather the climate emergency. For me, it's really easy to see how creative approaches can underpin all of these policy objectives across our life course. And when we consider health in that holistic sense, according to the World Health Organization definition of a state of complete physical, mental, and social well-being, this encompasses quality of life and the ability of people and societies to contribute to the world with a sense of meaning and purpose. The things that keep us well, primary prevention, the things that stop problems escalating when a problem has been identified, secondary prevention, and those things that help us stay well once living with existing ill health, tertiary prevention. But to deal with these issues, we need to go well beyond the traditional clinical approach. Creative health has proven to have benefits for physical and mental health conditions, as well as improving general well-being, reducing loneliness and isolation in individuals. It also acts as a really vital component of place and community-based approaches to population health, interacting with the wider determinants of health and influencing the environments in which which people live, grow, work, and age. Creative health has opportunities to tackle some of these issues across the life course and across many different settings. And highlighting here the social determinants of health, so the things that really create the 85% of our well-being across a population. The people that we live with, the communities we live in, the connections that we have, the lifestyle that we're able to have and adopt, the activities that we're able to engage with, the opportunity to come together as a community, impact of the local economy, the built environment, the natural environment, and the global environment. And all of those things are underpinned by creative health and well-being. So it's shown that as we've already heard from Katie there, around contributing to the prevention of ill health, but also most importantly, improving the quality of life, slowing the progression of disease and aiding very much with recovery. If the benefits are fully understood, it can be drawn on by individuals through everyday cultural engagement and creativity, or as a part of a targeted intervention to address a specific health issue. For communities, using creativity, cultural and heritage to improve the conditions in which people live and to build social connection. Healthcare professionals as an additional component of the professional toolkit. I'm sure that many people in the room will sometimes feel like they've gone as far as they can with the existing tools in the box. So actually creative health offering an extra opportunity to engage with patients. The health, social care and wider system to help meet a range of targets and importantly to provide a better service, and for policymakers as a means of taking some of the pressure off the challenges we currently face. We can't continue with the NHS in the way that it is, with all of our money being spent at the high-end crisis. We need to be getting through into prevention, whether that is primary, secondary or tertiary. But just a note of caution, this does need to be done really carefully and take account of people's circumstances. As with anything in healthcare, there is the risk of the inverse care law, where those more affluent communities can participate, with less affluent finding access much more difficult. I have heard people say, creativity is not for them. I've had people in Gateshead tell me that they've never been in the Sage, they've never been in the Baltic. They are 3rd generation, 4th generation living in the estates that are within walking distance, but they don't see those spaces for them. I've heard people say that they need to have, that they don't feel that they would be welcomed into those spaces. So there is something that we need to be mindful of when we're sitting in rooms and trying to think about what works for the communities that we serve, that we actually talk to those communities and ask them what works for them. Take some of the support out into the communities, into our wonderful community voluntary sector projects that are often rooted in our most disadvantaged communities, and having the trusted relationships that you need to have to be able to get through the door. We can't do it all alone. So we need to make sure that we are thinking about creative health in all of different settings. And, it's brilliant, the work that's happening here in the Trust, but we need to make sure that when people are discharged from hospital, that they have the same opportunities at home as they had when they were in hospital. So I've got permission to share this, but so my 19-year-old has some significant mental health problems, and a couple of years ago was sectioned on a couple of occasions and spent time in a unit down in Middlesbrough and then in Prudhoe. And actually what he had there was access to some amazing creative health activities that really enhanced and brought on his recovery. But then he was discharged to nothing in the community. He wasn't even able to access his final year at school because the school were unsure about how they would manage him within school with the mental health problems that he had. So we need to make sure that this isn't a system that focuses on the inpatient alone. It needs to have an inpatient and into the community and community settings. And like I say, he's given me permission to share that. So whilst I won't claim it's a panacea, we know that the clinical interventions are absolutely appropriate, and so it's not a replacement for those, but it does look at that additional, and particularly thinking about quality of life for patients who are affected by some of the most prevalent health conditions that we've got. So, and this is the evidence that I'm talking about that came through the APPG. So where creative health has been incorporated into care pathways, there's evidence of a reduction in the burden on the NHS, as patients have become empowered to self-manage their conditions, leading to a reduction in GP and A&E attendance, and in some cases, less reliance on medication. There are many health conditions for which creative health can have significant benefits. And whilst the examples I've shown on the slide are not exhaustive, they do demonstrate how creative health can contribute to the conditions affecting a large number of people across our city. There is good evidence to support the use of singing, which you've already mentioned, to improve respiratory conditions such as COPD, improving lung function and capacity, and the ability to regulate breathing patterns. Singing for lung health interventions, when it was evaluated, consisted of a 12-week singing programme for people with COPD, and it was shown to reduce the utilisation of healthcare, like I say, including GP and also hospitalisation. A pilot in Gloucestershire for COPD, asthma or anxiety saw a statistically significant increase in reported mental wellbeing scores, a 23% decline in A&E admissions and a 21% decline in GP appointments in the 6 months after the referral compared with the 6 months before, with an estimated return on investment of £1.69. Creative health has also been used in the prevention, management and rehabilitation of cardiovascular disease. Systematic reviews show that dance activities for older adults, improving aerobic capacity, reducing the risk of cardiovascular disease, and a cohort study based on the UK population data from over 48,000 individuals found that medium intensity dancing reduced the risk of death from cardiovascular disease. Creative health approaches have also been shown to be effective in supporting patients to recover from stroke or brain injury in both hospital and in community settings. The effects of stroke, as we all know, can be devastating, with almost 2/3 of survivors leaving hospital with a disability and half experiencing depression. Music has been shown to have positive effects on recovery from stroke through improvement in the neural pathways and memory, as well as reductions in depression and confusion, whilst participation in arts activities can have physical, cognitive and emotional and social benefits for stroke survivors. With an increase in life expectancy over many decades and improved treatment options, more people are living with conditions associated with older age, such as frailty and dementia. Creative health supports people to live well for longer as they enter old age, with the associated benefits that I've already spoken about for our health and care systems. I've already spoken about dance and shown to improve strength, mobility and balance, and therefore mitigating frailty or falls, reducing falls in older adults. And there's a really strong body of evidence detailing the benefits of creative health for people living with dementia and in preventing cognitive decline. I could probably go on all night, and I don't want to because I'm really interested in the discussion that we're going to have at the other end. But, you know, I'm sure that we all recognise that the role that this has played in all of our lives, the fact that we're sat in this room tonight means that we're probably, you know, already won over by these arguments. And if there is anybody who isn't already won over by these arguments, then, you know, we can have a conversation afterwards. But actually, the most important thing is the advocacy that we've got now, because when I looked at, there was a report that was done in 2016 that looked at the resources and where the resources were going in the health and care system. So around 60% of our money is spent in hospital treating ill health when it occurs, around 18-19% in primary care, 18-19% in social care. There's a tiny proportion of the budget that is spent on prevention. And actually, we are hearing at the moment the government talking about moving from treatment to prevention, and creative health offers us the opportunity to do that in a way that's engaging and people will be able to be supported by. So I'll stop now because I could rattle on forever, but thank you very much.
Thank you very much for inviting me, and mine is going to be a little bit different. So Alice has expanded on all the evidence. I'm going to introduce myself first, and I'm going to introduce where I have two hats. So this is actually my presentation is going to cover a little bit of my experience on both sides of the fence of healthcare and my experience with the creative arts. So I'm going to just talk a little bit about my role in the hospital, my vision for working with Kate and the creative arts, and then just sharing my lived experience, as I said. So the public health role in the hospital is relatively new. Well, basically, maybe I've started the same time, around 3 years ago as a member, but a little bit over 3 years ago. I was employed by another organisation, seconded into the hospital, and then I moved over to Newcastle Hospitals. These roles are new, but I work very closely actually with, I consider myself as part of Alice's team, but working into the hospital. As Alice has said, we only do 15% of the overall health, but actually there's a lot to do on this side of the fence. So I feel I am an agent of change in a way, because I'm one person. I work in various teams, and maybe those teams won't have public health in their titles, but they do a very important job, whether they are the peri-op, nurses, where we've got people on the front line, not necessarily doing public health, but they do a very important role for public health. I've put the definition for public health over there, so that's the science and art, and I just want to emphasize that, because we do a lot of science, and I do loads of numbers and statistics and epidemiology, but we really don't pay so much attention to the art. And whether it's the art of collaboration, the art of engaging with communities, the art of bringing the voices of patients, but it's a really important role for public health. So that's just, I wanted to emphasize it. And these are all the things that I do. So I do research, I do, kind of work around evidence, a lot around, epidemiology, statistic analysis, intelligence, but embedding equity and prevention is very much at the core of my role, and that is working in collaboration. Whether it is with the public health team, as I said, but with wider stakeholders and the third sector is very, very important. So I'm going to move into talking about my vision and the vision for the hospitals. Since actually Kate started in post, I was really excited about having, creative arts in hospital. And I feel very much like Katie, maybe Katie's got a team, but I do feel like there's so much of an alignment in terms of what we could do. So, I do feel health, the role of arts and public health is both for both workforce and it's for patients in equal measure. And actually, if we have a finite resource, I would say prioritize our workforce, because if we get it right for our workforce, we will get it right for patients. We shouldn't have to choose, actually. We should be doing both. As Alice said, the co-production, working in partnership is really, really important. And that life course approach. So Alice, you did mention about Marmot and the best start in life. I was recently in an event in the hospitals. We were talking about the Great North Children's Hospital and a vision and strategy for the hospital. And I did mention, I put on a slide saying, if we do our interventions, if we do early intervention and prevention as early as possible, actually since the child is unborn, from the days, from early conception, we have a lot of evidence that these are a lot more effective than doing them later or not doing them at all. So actually, if we do have our limited resources, as we do now, and there is a lot of budgets that have been cut, we need to prioritize early years, and I always say that. So within my life course approach, and I'm one person, I have prioritized maternity and early years, but I do work across, and I work very closely with colleagues around frailty strategy, on substance misuse. So the work is across the life course. Alice, you mentioned something also important about the inverse care law. It happens a lot, and I want to actually explain that a little bit because it is really important for our hospitals. We are seeing more complexity in our population, particularly in the younger age population. Actually, I was looking at some of the school-based census. We've got increasing levels of poverty in the younger children and families. And we've had actually, as a region, Northeast region, the sharpest increase in poverty of any region. I think it's second to the Northwest. So we've got over 35% of our families living in poverty. We have increasing diversity. So we've got 139 languages spoken. I was really shocked by that figure and saying, what are we doing for our translation and our interpretation? Who's coming into hospital? How are we serving that in terms of the diversity? That is really relevant to the arts in terms of the cultural diversity and how we bring those voices. So inverse care law is actually worse quality of care to those most in need. And we find that actually is also relevant to our workforce. What we are finding is we are serving an increasingly complex population with the same level of, we're not rethinking education. We've got multi-morbidities, people living with more and more longer term conditions and starting their journey of ill health younger. But our workforce is only prepared and trained actually to work in these silos or vertical programs. And we're not actually prepared as an NHS for complexity. We need to rethink, as Alice said, and that's, I think, an agenda for public health and the arts. Proportionate universalism is a really important concept of Marmot, and I always quote it. And that's actually when you've got your resource, you've got a limited resource, you have to, you plan your programs in a universal way, but actually put more resource where there's more needs. So we really need to understand who in our population has more need. And we have something called the community promise, and I know our chief exec is very kind of interested in that, and it's more promoted at an integrated care system. It's what we do as an anchor organization to serve the communities here, and it's about employment, about the real living wage, all of that. And I think that's really important, again, for us in terms of the art. So my story, as I said, I'm not only a public health professional, I have actually experienced health on the other side. My son in 2020 had suddenly was paralyzed. He had a very rare illness, a neurological illness. We stayed in the Great North Children's Hospital for over 6 months and then down in Stoke Mandeville for 2 months. And it's not ended there, sadly. I mean, this week I'm off on carer leave the rest of this week because there's lots of appointments. So I have been experiencing, I have got that intensive experience of what healthcare and social care and the wide range of things. So I've written about my story, and actually we had the New Writing North and the wonderful Laura work with us with the staff here, and it was a really transformative opportunity. I don't say I write poetry. I've had really low confidence, but I kept a journal while I was in hospital, and I used some of it in the writing experience. And we had, actually, it was a year ago, I can't believe that we were down in Manchester for our National Health Stories, where then we did an anthology, was it April? Where in the northern stage we kind of presented some of that work. So I shared some of that story, some of my story, and the wonderful care that I've received on the other side, and seeing that from that side has been transformative, and I've seen actually firsthand what creative arts could do. And I'm going to share that with you today, with the permission of my son. Actually, one of the songs, he wrote about 100 songs while he was in hospital as a 14-year-old. Mostly rap. I didn't actually, it's opened the world for me. I wasn't really into rap. I am not, but he's convinced me that there is a role of rap in terms of, telling your story. This is actually some of the pictures. So this is actually, we spent a lot of time in the therapy room in Ward 1B. And that was actually, you'll be surprised at where a lot of the arts happened. So whether it's the clown doctors, which you were one, Laura, haven't you? And that was in the height of the pandemic. So we weren't very lucky because we've not actually experienced it. Lots of those art programs in terms of exposure were cut during the pandemic. And this is my son who wrote a song for, I think there was a physio called Norma who retired. And they planned, her retirement due, and he actually wrote a song for her, and they performed it with the person who was playing on the guitar was actually from the Bridges School, who came in and they performed it together. So it was a wonderful opportunity just to be part of a workforce thing. So today I'm just going to actually, before I share, this is actually the image in the MRI room. And I was with my son so many times in that room because of his spinal condition. We had to take a lot of MRI scans, and it's sometimes quite lengthy when you do the whole spine. I was sat and staring in that picture on, the blue skies, and it really helped me. It's these where the art is, at those, the places where we probably might not think that they are important. This is very, very important. So diagnostics. I know we put a lot of pictures on the wall, Katie, but this is a space that is really important. So I'm going to share with you his first song, so Daniel's first song, and he's got his, I'm not putting a plug for him here, but he's got a YouTube channel, and he's put them on all platforms, and he had a fund from the Community Foundation and Youth Music to actually record. It's called Day by Day. It was on the last, when he was admitted, he was in Pico in intensive care, and he wrote this on the last day when he could move his hand because his hand was affected just before he moved to the ward. It's called Day by Day, and I just probably need some help to get that one because I couldn't embed the video in. So this is just to illustrate the lived experience of someone who's done it on the other side of the fence, and it shows the journey. The pictures will show you that journey we had. Thank you very much.
Thank you very much, Bassam. So I have lots of questions, but I'm conscious of time. So actually, I'd like to open it up to the floor. So we've heard about systemic kind of approaches that we have, lived experience, personal experiences. So I just wondered if there's anyone who wanted to start that question. I could ask something around education of staff in care and social settings. So connections with HE and FE around creative health, because I think it's something that we all really believe in and are passionate about, but the system, the education system, doesn't necessarily have creative health embedded in it. So how do we expect people to be able to advocate for that, for their patients or for those that they care for? Was that something you wanted to come in to, Alice? Yes. So I can give the mic here.
Hello, I'm Alice Thwaite. I'm the National Centre for Creative Health Associate for the North East, North Cumbria and Yorkshire. Bit of a long title. Just on that point, I've been working with Northumbria Uni because their nursing and AHP, allied health professional courses, to connect with creative health organisations in the northeast so that people will go on placements, because I think they need to see the broadest type of creative health that there is, so that then in their work life they will have an understanding of it. So that's happening in one university. It'd be great if it could be in all of them.
Thank you. Thanks, Alice. And I think there's also something around the CPD and the continued professional development and how we think about that in the region as well. There's a question here, so I'll just wait for the mic if that's okay. Thank you.
Hello, I'm Christine Fraser. I'm a Gateshead Community Bridge Builder, and I work alongside Paul, who's also a Gateshead Community Bridge Builder. We work on the ground in communities all across Gateshead, and I am so buoyed to hear that you're talking about research and about the importance of research to ensure that prevention, as you've already, all three of you mentioned the word prevention, so that prevention and community access can be a real part of our healthcare system. I tell you a very quick anecdote. There is one lady who comes regularly to the knitting group that we have. Her sight is diminishing, her hearing is diminishing, and it was only when she realised that when she went into hospital, there was one of the nurses who gave her a knitted heart to say, keep going, you're doing very well, we really respect you. She's now made 400 knitted hearts to give back to the health community that she's a part of. If we are going to have research, and if that is going to be important, can we have it accessible to our communities, please? Can we make sure that these amazing young students at FE and HE are going in and not just mining for gold, for jewellery we'll never be able to afford, but for actually accessible research that we can use and understand?
Thank you. Thank you very much. I've got another question up here.
Hi, my name is Jenny Firth Cousins. I'm a psychologist, but I've done a lot of research on the health of health service staff around the world, and quite a lot in the north. One of the things that sort of stood out for me, I followed up the staff after the Omagh bombing, and there were 3,000 staff involved in a very tiny Omagh Irish hospital. What I've heard tonight makes me think if only I'd asked them exactly what happened to them afterwards in terms of how they kept themselves healthy, because quite a few did, but you can imagine that the trauma after it was really, really awful. But most of them who didn't turned to alcohol as the only way of getting over this. And right through the work that I've done over about 40 years in various hospitals has actually shown that is including the doctors, everybody, that's the method that so many people are using. So I think the more that we do this, not just for the patients, which I think is wonderful, but for the staff as well, because everything shows that staff health actually impacts on patients enormously. Can I just add to that I've just seen, I'm a tough old lady now, but I was actually reduced to tears recently by watching a video from a paediatrician in Liverpool just describing, and a few videos to show, the conditions that people actually were living in. As you know, I'm middle class, lots of us are middle class. I think I go down a long way. I'm a Labour Party member and have been most of my life. But I had no idea what these conditions were, and there's a report out today about poverty and the impact of, children sleeping in mould and things like that. I suppose what I'm saying is whenever we think of the arts, we've also got to realise what conditions people are really living in.
Yeah, and I think, Alice, when you talked about that, it's actually how do we create the conditions for that within our communities?
Yeah,
I mean, so I think that during the pandemic, councils had to redeploy staff to work in a really different way. And what we did in Gateshead was we set up community hubs working with our community voluntary sector partners. So it didn't matter what badge you had on, you were all there for the same reason. And actually what our staff said to us at the end of the pandemic was that they hadn't realised that people actually lived like that, you know, in some of the most challenging circumstances. And it gave lots of people a kind of renewed desire to be able to tackle it and challenge it. And I just think you have to remember that when we're doing this work, which is why inequalities for me is so important. It's okay to put the services on for people, but if the people who are going to benefit from them are the people who need it least, then we need to be making sure that it is done jointly with communities. And it wasn't a creative health thing, but for example, we've got an issue with childhood obesity. We embedded a researcher in a project in the ward in Gateshead that has the highest rates of childhood obesity, and we said to them, to the families on that estate, help us solve this because we just don't know what to do. And they spent a year there, and the families came up with much more creative solutions to the issue than we did sitting behind a desk, but it was because it was led by them. And I'd made a decision at the start of the year that I wasn't going to say, oh, that won't work, there's no evidence for that or whatever. It needed to be developed by them. And I think that that's the type of work that needs to be scaled up. And I don't mean scaled up because it's got to be different in each community, but that's where the resources should be, that's where the investment should be. You know, hopefully we'll have more resources at some point in the next few years. But at least if we can start to move some of the resources from the really expensive end into some of the, you know, more effective projects that really start to tackle inequalities. So I'm absolutely with you. And the whole thing about alcohol, absolutely half of the people in Newcastle are drinking in a way that's harming their health. Half of the population.
Make an observation, I think, more than anything. You're talking about early years intervention, reducing inequality basically from a very young age. So, I don't know, observation. In the west end of the city, we're just building houses all over the place. We've got the View and more and more. Not enough primary school. I'm one of the directors of the West Trust, head creative at Newcastle Hospitals Charity. You know, we have not enough places for children. We don't have enough doctor surgeries. We've got a huge problem with kind of dental health. Canning Street, one of our 9 primary schools, over 100 you know, kind of different languages spoken as a first language. It's incredible. We at State Royal, we've invested hugely and committed to working in the west of the city. That's a tiny fraction of what we can do. But it's at what point are those young people without you know, access to doctor surgeries, without access to leisure centres, without all those things that goes on? When can that change take effect? Because already we're seeing early years. So if we're kind of going, well, we're going to work with children who are 10 and older, we're going to map them for the next 10 years. What happens now to these young people who are going to come through our school system without access to all these primary services that just aren't there? Anyway, as I say, observation more than anything, but it's really interesting. It almost feels like we're all, as a society, we do something and say something with one hand and then take it away with our actions in another. So at what point can we, what's the answer?
Yeah, no, I mean, it's a real challenge, isn't it? Because you can't pretend that a generation has gone before. But there is something about how you are clear about what the priorities are at different stages of the life course and how you wrap around those things, because we all want to do everything and we can't do everything. So interesting though, today we've had a presentation at our Health and Wellbeing Board in Newcastle around young people and what they think. It's a health-related behaviour questionnaire. There's 6,000 children and young people across Newcastle completed it. So it's their perception of health and the things that matter to them. And the things that I think really resonated with me was the number of kids who are starting school without having breakfast and potentially not having a school lunch. There was a whole issue around expectations around how they'll be treated by other people. So acceptance that people may have coercively controlling relationships, and that is acceptable for a small number of people. Some really positive stuff in relation to reductions of the children and young people who are drinking alcohol. like, you know, over the last sort of 10 years. You know, so some really important stuff coming through that. But I also think that if you think about this generation of kids, right? So my son was born in 2005. 2008, there was the bankers crash and, you know, all of the upset that went along with that. Then there was the, you know, sort of change of government and austerity, you know, kicking in really. And then you've got, you know, the COVID-19 pandemic, the cost of living crisis. So you've got wars across the world. And you think that this generation of kids have had a really like disjointed childhood, you know, and actually there's something about, if you look back at the kids who were teenagers in the 80s, and I'm one of them, there's a range of poor outcomes that have followed that generation, because that was the last time we saw that. So we know that, that's history that tells us that. So then there is something for me about how we focus on all of those kids, but we don't get to the point where we're blaming the young adults for not being whatever we would want them to be, because actually they haven't had the circumstances to do that. So that's not an answer. But, you know, there is that whole bit around, and it is about how we all work together as well. There was some stuff that worked in the past. So Sure Start Children's Centres did work to reduce inequalities. We might do it differently, and we'd have to make sure that we were reaching out to those communities, because I think those who are most disadvantaged didn't benefit from those either. But actually that type of approach, I think we know what works. We just need to persuade the government that they are brave enough, because actually they're worrying about waiting lists, they're worrying about, you know, and that's, you know, important, but if we only focus on those things, then we're never going to get into the prevention side of things.
I just want to add something, because it was raised I was part of a community grassroots boot camp around transport recently in Newcastle, and this whole thing about planning and, you know, planning new housing, is very much also linked into, you know, our roads and transport and public transport and access. So it's really a planning issue. You know, it is something that is relevant to planning. So that's where we have to join together and not silo agendas. And I think that's really core, because it is not only about access to schools, it's about access to lots of other things. So yeah, it's just how we collaborate and work rather together. Around issues, and that's very much at its heart is a planning issue, I think.
And actually on that, sorry, just quickly, because the Newcastle Council is consulting on the local plan. Yeah. So the local plan across Newcastle, they're doing it jointly with Gateshead. So it's kind of feed in these types of things. There is a real view in the council that we're going to look at every single policy decision that we make now through the lens of health. So what is the health impact of whatever it is, and then we can look at mitigating negative impacts and maximising positives. But your voice in that consultation will be really, really important. And actually the other thing that struck me from today's presentation was that children in the most disadvantaged communities have less access to good quality green space.
Yeah, absolutely. Yeah. There was another question up there.
Alice, you take one last one?
I was just going to make a comment on that about the importance of collaboration, because there are fantastic small arts organisations all over the city, both Newcastle and Gateshead, that spend so much time fundraising for the money. And all the small arts organisations need the support from the anchor organisations of health to actually make sure that prevention money is in there and getting to the people on the ground who actually want to access it and need to access it.
I mean, we had a presentation at the Health and Wellbeing Board today from Connected Voice and Streetwise, who did a collaboration on the state of the community voluntary sector across the city. And they said exactly the same thing, is that people are spending so much time chasing grants. They're not actually, and actually the success level of grants has diminished because there's so much competition for it. But what can we do as a council differently to make sure that we can get the money out in a way that's easy, so that we're not just giving it to the big charities that are really good at writing bids and stuff, but it's reaching into the real sort of grassroots community organisations. So definitely was a challenge at the board today.
And the ICB as well.
Mm-hmm. Okay, everyone. I mean, I think Alice said we could probably talk about this all evening. I feel uncomfortable shutting it down, but we promised we'd finish by 7, so we're going to honour that commitment. I wondered if you'd just join me, first of all, in thanking our speakers, thanking Katie and her team, thanking Alice and Balsam and the newsroom. There's been fantastic experience and knowledge from our speakers this evening. There's been an equal amount in our audience this evening. So really grateful that you've come in the numbers that you have. But we've got a further ask of you, really. We're going to be sending you a short survey, which will be circulated after the event. We really, really welcome your feedback in filling that in. It helps us to run more successful programs going forward. So always interested in that. Also, just to mention that Newcastle Hospitals Charities present a series of discussions like this one. And the next one, for date in your diary, is going to be due in February of 2025. And the focus of that work will be on the Great North Children's Hospital. So huge thanks to you all, huge thanks to everybody in the team that have helped us to run such an interesting evening. I'm really glad I had a privilege to be part of it. But safe journey home, all of you. Thanks for coming.